It's really important that as a fire and rescue service we offer as much support as possible to vulnerable people and those at the greatest risk from fire in the home to keep them safe and improve their well-being and quality of life. By reducing visits in the home, our firefighters can use their professional knowledge and experience to better assess and identify the risks within the home. Also, the health and well-being element of the visit can be more comfortably discussed face-to-face with people by having a more personal conversation where we feel residents are more likely to ask for help and assistance. We understand the concerns that people have about physical interactions with others while the COVID-19 virus is still present within the communities. But please be assured that we've taken all the necessary precautions to keep both residents and our firefighters safe. The delivery of our home visits have been risk assessed, and the following short video will explain how the fire service will conduct them so that both our staff and the public remain safe and know what to expect. I hope you find the following information useful. Thank you.
When Community Safety arranges visits by telephone, we will ask these questions when on the phone. If anyone in the property is in self-isolation, if anyone in the property is showing symptoms of COVID-19, if anyone in the property has a current diagnosis of or is awaiting test results or is in quarantine for COVID-19. If the answer is yes to any of these questions, the visit will not be undertaken and will be rescheduled. If the visit is to go ahead, we will then explain to the occupier the COVID-safe requirements. These are the possibility of conducting the visit at the doorstep, if access to the premises is necessary, then opening windows during the visit to enable ventilation, opening all doors that could be touched by service personnel during the visit. On the fire engine and away to do the pre-booked visits. On arrival at the premises, knock on the door and stand 2 meters back. Before entering a property, the above questions will be asked again. Here's a reminder. If anyone in the property is in self-isolation, if anyone in the property is showing symptoms of COVID-19, if anyone in the property has a current diagnosis of or is awaiting test results or is in quarantine for COVID-19. Again, if the answer is yes to any of these questions, the visit will not be undertaken and will be rescheduled. If access to the premises is necessary, we will politely remind the occupier of the COVID-safe requirements and confirm whether these have been done. If a window or doors cannot or will not be opened, then a doorstep visit will be conducted. If the visit is to go ahead, and if 2 meters distance can be maintained in the premises, staff will wear single-use disposable gloves and wear an IIR fluid repellent mask. If 2 meters cannot be maintained in the premises, staff will wear single-use disposable gloves, wear a plastic apron, wear an IIR fluid repellent mask, wear eye protection. When we arrive for unscheduled target visits, we will knock on the door and stand 2 meters back. We will then ask the occupier the appropriate COVID infection questions as stated earlier. If the occupier answers yes to any of the COVID screening questions, we will return at a future date and/or ask the occupier to ring the service if they would like advice in the future. If the occupier answers no, the visit can be conducted. If access to the premises is necessary, we will ask the occupier if a window can be opened for ventilation and also to open any doors that could be touched by service personnel. We will request that the occupier maintains 2 meters, that's 6 feet 5 inches, distancing during the visit and wear the correct level of PPE dependent upon 2 meters or 1 meters distancing. The visit will be kept to as short a time as possible. For all visits, both telephone arranged and targeted visits where the occupier is clinically vulnerable but not shielding, for example over 70 years old, we will follow our guidance, as stated earlier, around telephone calls and cold calling. An assessment will be made whether clinically vulnerable people could be exposed to risk by entering their premises, and we will take into consideration the controls of social distancing, opening windows and doors, and wearing PPE. If the risk of exposure to vulnerable people is high, we will conduct the visit at the doorstep or, if possible, rearrange for a pre-booked visit to take place. End of community safety duty and on return to home station. At the end of our visits, all vehicle touchpoints will be sanitised as soon as practicable.